Hello, today I will be talking about the healthcare system in the US. There are different parts of the healthcare system that all work together. First off, there are providers, who are people such as doctors, nurses, hospitals, and pharmacies. The providers, as in their name, provide the care. Then there are patients. Those are the people who are receiving the healthcare. And finally, there are insurers, who for the most part pay for the healthcare. In some cases, the government pays for healthcare through tax money using programs such as Medicaid. Insurance companies also get paid. For the most part, insurance companies are paid by employers. Some patients buy an insurance policy directly, but most people work for an employer, and the employer makes the arrangement to buy the insurance and then charges the patients. Patients pay premiums and copays, which are parts of different insurance policies that they can select. Premiums are a set amount of money that's paid to the insurer every month. Copays are another set amount of money that's paid to the provider each time the patient goes to visit the doctor. There are also other parts to insurance policies, such as deductibles, coinsurance, and much more. America was one of the last industrialized countries to have comprehensive health insurance for its patients. In the olden days, like if you go back 100 years, the US didn't really have insurers. We had patients and providers. Before insurance, if patients had a question or concern, they would just go to the provider, make some deal, pay them some money, or do some service for them. The US got insurance companies in the last 100 years, really starting in the US in 1930 and becoming more popular in the 1940s. Insurance companies are a big part that has been added to the healthcare system, and a lot of controversy comes from the cost of insurance and how that's covered. Today, the US spends $3 trillion annually on healthcare, or about $9,523 per person. Currently, the Affordable Care Act is in effect, and it has three primary goals, which are to make affordable health insurance available to more people, expand the Medicaid program to cover all adults with the income below 138% of the federal poverty line, and support innovative medical care delivery methods designed to lower the costs of healthcare generally. There are two basic sides to healthcare. Most conservatives believe that it's the government's job to make sure citizens have the freedom to choose their healthcare. Progressives, on the other hand, believe that the government has a responsibility to make sure that every citizen has access to healthcare regardless of their income. The healthcare system in the US is very controversial, but there are possible solutions and some next steps we can take. People within the Democratic Party say that there should be a Medicare for All system, which is a single-payer, government-run healthcare program in which all Americans are covered. Critics point to longer wait times for certain care in some countries with single-payer system. Other critics also say that with Medicare for All, healthy people pay for sick people's care. However, supporters of Medicare for All argue that it lowers overall healthcare costs and forces hospitals and doctors to provide the same standard of service at a low cost for everyone. Other Democrats who oppose single-payer plans favor making a Medicare-like plan optional instead. There are numerous competing bills and proposals for a public option plan, or a buy-in to Medicare or Medicaid, that differ in how many individuals or businesses would be eligible to participate and how the government plans would function.